I'm sure most of you have heard the latest figures in the US, where rates of autism has risen again, with the prevalence now at 1 in 59. Although we don't have actual figures for ourselves here in Malaysia, needless to say, I'm sure all of you are now increasingly seeing children who present to your clinics with symptoms of speech delay, difficulties with communication, socialization, as well as having certain restricted and repetitive behaviors. And these are essentially the core features of autism spectrum disorder. It's important that all of us understand the difficulties that many of these children have. A couple of important points. Initially, the diagnosis of autism. Sadly, the CDC figures show that the age at which diagnosis is done is still at around 4 years, although the symptoms present as early as 18 months. There are even red flags that had been shown to be early signs at 12 months, and research is now showing that we can even pick up subtle changes in their social development prior to a year in about half the children who are later diagnosed with autism. We are very lucky to have a child health record book that encourages parents to fill in information about their concerns about child development, and as professionals we need to screen children for some of these early symptoms, because early diagnosis results in hopefully early intervention, which can help reduce some of the long-term disabilities. It is also important to remember that these children grow up to become adults who continue to have the difficulties that a person with autism has. And one of the important aspects is empowering parents on what they can do alongside advising them on interventions that are available. Many pediatricians express their concerns about not knowing where to access intervention. I do feel that this is no longer a valid reason not to diagnose or not to empower ourselves to know how we can, as individual professionals, help parents along their journey in this difficult path. There are many allied health professionals available in government hospitals, in NGOs, as well as practicing privately, who may be able to help these children. With increasing number of professionals and with increasing number of children being diagnosed, I'm certain that we can push for many of these services to be available. Lastly, it is important that we adapt our practices to serve children with autism better. Many of them are not able to access medical services because of the fear that their children may not be diagnosed properly if they turn up with any intercurrent illnesses. Many parents also express their disappointment sometimes at professionals not treating their children or being afraid to treat their children as well. Hence, as medical professionals, especially pediatricians, it is important that in our medical practice we adapt to include children with special needs, not just children with autism, so that they are able to access medical services when necessary and diagnosis of other illnesses is not delayed, as is what is happening right now. I hope that all of you will try to attend the Malaysian Paediatric Association Congress, our 40th Congress, which deals with marginalized children. And in that Congress, we hope to address and have a discussion of some of these points that I have just raised. Thank you.